So at the Public Health Institute of Oklahoma, we believe that our rural leaders are the experts of their community. They know the challenges, they know the solutions, they know the barriers to implementing their solutions. So we look to our rural communities, our coalitions, our public health departments, those faith-based groups that are really working to change the landscape of healthcare delivery in a rural space. And challenges like this allow them an opportunity where it's a very diverse group of people. We might have people from tribal entities all the way to a Sunday school class coming to this challenge, and they're ideating together, they're learning together, and then they can take that learning back into their communities and transform their initial innovation, but really start thinking about even further long-term sustainable solutions to the challenges that they have identified.
How do you have an average of how quickly a community can implement something that they have innovated at one of these challenges?
Yeah, so we have some really historical examples of how this innovation challenge has supported communities over the years. In 2019, when we gave our first innovation funding awards, there were some programs such as Handle with Care Oklahoma that had just begun their efforts at the state. Now we're into this space where they're looking at national policy around Handle with Care. We have the Oklahoma School Security Institute, the Office of Homeland Security, now partnering on a mental health project, all because we had this opportunity very early on in 2019 to bring that group and elevate them across our landscape. And so we see really that it doesn't have to start with, that one idea. It can grow and be implemented very quickly. And many of our solutions also are, now 5 and 6 years deep and still being sustained off just a small amount of seed funding that we gave through the Rural Health Innovation Challenge.
About the diversity of interest in supporting this type of event.
Yeah, our 2024 challenge is, I think, really unique as compared to our past challenges, where we at the Public Health Institute and the Oklahoma State University Center for Health Systems Innovation were funding this initiative. We reached out to a diverse set of partners this year to really generate some new interest in donating funds to the Innovation Challenge. This year we had everyone from our tribal nations, our state agencies, our managed care organizations, local grassroots nonprofits giving to the challenge because they knew that that money was 100% going back into the community's hands for them to implement the solutions that they know as the experts of their communities would make an impact.
Perfect. What else would you like to talk about?
I would like to talk about the fact that the 4 categories of the challenge this year are aligned with the Oklahoma State Improvement Plan, our health improvement plan.
Okay.
And so those 4 areas, I think it's really because state agencies do not give money, and they gave a lot of money this year. So I really want to reinforce that for them.
All right, let's talk about that. So there are 4 areas of focus for the solutions or for the challenges that people are bringing to be looked at and brainstormed to potentially come up with a solution for them. So can you tell me a little bit about those?
Yeah, this year our 2024 Rural Health Innovation Challenge categories surrounded the Oklahoma State Health Improvement Plan. The plan is in its developmental stages, and we saw this as a really excellent opportunity to align with the State Health Improvement Plan, challenge our communities to think about how they could create solutions in the areas of diabetes and obesity, cardiovascular risk reduction, mental health and substance use disorders, and the social drivers of health. And so there's a lot of overlap in those 4 areas. So this year in our 23 individual organizations that are participating, many of them that are hitting on all of those areas. And so we really see that this is an opportunity that they're coming to the table to try to solve one challenge, but there's an opportunity to really dive deep into it and solve multiple challenges a community may be experiencing.
And that benefits everybody.
Oh, it benefits all of us. It benefits our health outcomes, whether you live in an urban or a rural setting. It really impacts our healthcare spending, urban or rural settings. So it really does create a very intentional alignment with innovation, our state health improvement plan, and our state health equity plan. Okay, sounds great.
Thank you.
Yeah.